From our work sites to our homes, it's on all of us to protect our communities. Right now, being safe at work begins with being safe at home. To get the word out, we're building new alliances and taking steps to keep ourselves, our coworkers, and our loved ones safe. We need to continue to stand united against the threat that COVID-19 poses to our health, to our families, and to our communities. It's going to take all of us, workers, public health experts, industry leaders, elected officials, working together to stop the spread of COVID-19 in the construction industry. Working collaboratively, we've taken steps to make job sites safer. And even while staying apart, we have joined together to fight back against this pandemic. It's important not just for ourselves and for our loved ones, but for our frontline heroes and first responders, for our neighborhoods, and for those who are most vulnerable. Together, we will build back better and revive our local economy safely while protecting workers, families, and our communities. Welcome to Construction Stops COVID.
Good morning, everyone. Thank you for joining us this morning as we continue our battle against COVID-19. And thank you to so many who've been working so hard to keep our industry safe. My name is Brian Doherty, and I work with an incredible team of people here at the Greater Boston Building Trades Unions. And we are so proud to be joined on this call today by so many partners and allies, both in the industry and in the fight against COVID-19. We know in construction that safety is always our top priority, both on and off the job, which is why we're excited to announce today the launch of Construction Stops COVID. Construction Stops COVID. We begin by thanking Mayor Walsh for his remarkable leadership in these challenging times, and also for connecting us with global and local public health experts to create the strongest possible safety protocols in order to win the fight against COVID-19. The Greater Boston Building Trades Unions, along with our union contractor and industry partners, are honored and excited to be teaming up with Partners in Health, Harbor Health Services, the City of Boston, the City of Cambridge, and so many more to kick off what we believe will become a national model for COVID-19 safety and prevention within our industry and beyond. This innovative effort will introduce testing hubs where there are high concentrations of construction activity throughout our region across Boston and Cambridge, and an industry-specific public awareness campaign to keep workers and their families safe, both at work and at home. This multi-platform public awareness campaign will be promoted across the entire Boston metropolitan area. Now, let me say a few words about our incredible partners and incredible allies. First up for our allies is Partners in Health. Partners in Health is a global health organization restoring social justice by bringing quality healthcare to the most vulnerable around the world. We are honored that they have chosen to work with the Greater Boston Building Trade Unions and our industry partners to build upon the great collaborations that began in the spring and summer of this year, when our industry first set out to create COVID-19 safety protocols and practices in construction. Also, Harbor Health Services, a local nonprofit public health agency whose mission is to help our communities promote health and to stay safe. We are so thankful to have them as part of this initiative and to become our allies, as we are eager for you to hear from them today. The Construction Stops COVID initiative has underscored the power and the importance of the Joint Labor Management Partnership. It showcases the power of what can happen when workers, unions, contractors, and everyone in the industry has a voice and comes together to come up with solutions. Construction Stops COVID has been coordinated and launched with the support of construction managers John Moriarty and Associates, Suffolk, and Turner Construction, along with the support from so many key stakeholders, all of whom have been working collaboratively since March of 2020 to beat COVID. We'd like to say a special thank you to those who came together to launch the first round of safety protocols as part of the COVID-19 Construction Safety Subcommittee. We really appreciate all your efforts. That subcommittee is made up of construction unions and area construction companies and has now joined forces with global and local public health experts to form this new round of safety, and we're calling it Construction Stops COVID. Thank you for joining us this morning. Now, it is my privilege to introduce our keynote speaker, Boston Mayor Martin J. Walsh. Mayor Walsh has been a champion of public health, a champion of workplace safety and workers' rights, and has been an incredible leader for our city and for our region throughout this difficult pandemic. His actions have saved lives, and he has played a key role in bringing us all here today. In March 2020, Mayor Walsh was widely praised for making the bold, early decision to pause construction sites in Boston, allowing labor unions, construction companies, and developers the time necessary to come together to develop new safety and training protocols, and to establish a safer path back to work when job sites reopen through a phased-in approach. We are incredibly grateful for his leadership, and we are incredibly grateful for his commitment to the health and safety of everyone who works here, who lives here, and who visits our great city. It is our honor to introduce our great mayor, the mayor of Boston, Mayor Martin J. Walsh.
Thank you, Brian. Thank you for that great introduction and your leadership of the Greater Boston Building Trades Unions. I certainly appreciate those kind words, and I want to say how proud I am of how the city has come together this year. This has been one of the hottest years in recent history, and the people of Boston and surrounding communities have stepped up to the plate. The measures we've taken have saved lives. I'm deeply grateful to everyone who has rallied around our efforts in order to protect their friends, their families, their coworkers, and all of their fellow Bostonians. The building and construction trades on the call today have been a great partner to the city for a long time, from workforce development to creating good job opportunities for our young people, to fighting the opioid epidemic and now COVID-19. This year, labor unions and their industry partners have implemented standards that lead the nation for COVID safety. I applaud your efforts, and I'm encouraging every sector of industry across our state and across our country to follow suit. I also want to thank and recognize the doctors, nurses, and the public health experts who are on this call. Your expertise has saved lives at every single turn, and we continue to rely on your partnership for keeping people safe and getting our community through this very difficult time. Finally, I want to acknowledge everyone and anyone who has lost a loved one on this call to COVID-19 this year, and anyone who is struggling with the illness themselves. You and your families are in my heart and on my mind every single day. And my team and I are working around the clock to combat this crisis. Early on in this pandemic, it was clear how dangerous this virus was, so we took decisive action. In a matter of days, we closed schools and restructured daily life for over 700,000 residents. We put a system in place to keep our kids fed, learning remotely while the schools were closed. We brought together city, government, healthcare sector, and business community to build a 1,000-bed field hospital in just 5 days. Some of you did that, thank you. We made the call to temporarily shut down construction until we could develop a comprehensive safety plan to protect workers and their families. And I'm proud that we did the right thing and put a smart plan in place so that people could get back to work in a safe way. As we continue to respond to this day-to-day reality of the virus, we're also working hard, planning a strong long-term recovery. Boston has been ranked the #1 city best prepared to handle a COVID recession. That's because of our strong economy and our responsible fiscal management. Keeping our building and construction trade industry strong will be crucial to our long-term recovery. And that's what this new partnership between the Greater Boston Building Trades Unions and Partners in Health and Harbor Health Services is all about. This is a historic initiative, and it's the first of its kind in the United States of America. We're setting the highest safety standards in the nation, and we're making sure workers have the greatest access to testing, tracing, and treatment. This will help them, their families, and our entire community stay safe as possible. It will also help keep our construction industry open for business. This effort goes beyond our work sites. We're also launching a public awareness campaign to remind everyone that being safe at work requires being safe at home. We need everyone to wear a mask all the time when they're outside their home. We need everyone to avoid gatherings and practicing social distancing. And we need everyone to listen to the medical and public health experts who are at the top of the forefront to our efforts to stop this deadly pandemic. Like I said, the building and construction trades industries have been the steadfast partner in some of Boston's most important efforts. You show what it means to be Boston strong, and right now we need your help more than ever. So this morning, I'm personally asking all of you to help us take our work to the next level. We're entering what will become likely the most difficult period of the pandemic. Boston is a national leader, and I believe that our building and construction industries will continue to rise as a national model for workplace safety in the time of COVID. So today, I'm asking all of you to recommit to these efforts and join us as we face these critical months of renewed vigilance and focus. This is how we'll keep industry strong, and this will continue to create good jobs for the hardworking people in our communities. This is how we'll keep our economy strong and get back to normal faster. This is how we'll help one another get through this. We're looking forward to hearing more about this historic initiative from the rest of today's speakers. But before I hand it back to Brian, I want to thank everyone for tuning into this important event, for doing your part to help Boston get through it. A community shows its true colors during hard times, and we're certainly seeing those right now. Thank you, and I wish you all a happy, healthy, and peaceful holiday season. Back to you, Brian.
Thank you, Mayor Walsh, for your leadership, for sharing this very important message, and for joining us today. These remarks offer us a clear perspective on moving forward and staying safe. And again, we can't thank you enough for your great leadership and for your help connecting us with the organizations on the call today that have helped to form this incredible partnership. Thank you, Mayor Walsh. Next, it is my honor to introduce Partners in Health CEO Sheila Davis. As CEO, Sheila leads Partners in Health in their efforts to apply the resources of the world's leading medical and academic institutions to the lived experience of communities who are facing public health crises. At its root, the Partners in Health mission is both medical and moral. It is based on solidarity rather than charity alone. She is a renowned global health leader, and we are so honored to have her joining us today as we launch Construction Stops COVID. Welcome, Partners in Health CEO, Sheila Davis.
Thank you so much, Brian. On behalf of the 19,000 employees of Partners in Health, we're so excited and honored to be here today to join this really critical effort. As you heard, Partners in Health is a global health organization, and we fight injustice by providing healthcare in communities that need it most. We're infectious disease specialists, amongst many other things, and have battled many epidemics around the world, including HIV, tuberculosis, cholera, Ebola, and now we're working hard with many of you as our partners to combat COVID-19. Our relationship with the Boston trades unions started in Haiti many, many years ago. One of Partners in Health's founders, Tom White, was an owner of the union company J.F. White, and he was one of our founders at the very beginning in the 1980s and supporting Partners in Health's efforts in Haiti. After that, for many years, since the 2010 devastating earthquake in Haiti, we partnered with Jim Ansara, who worked closely with us to build a hospital in Mirabelais, Haiti. This was only possible because of the many different unions and others who came to support and work alongside our Haitian colleagues to build this flagship 320-bed hospital. Over the 2.5 years following the beginning of the hospital construction, hundreds of Boston tradespeople came to Haiti and worked side by side with our Haitian colleagues to build this amazing place. It was led by the electricians, IBEW Local 103, and the New England Council of Carpenters, amongst many, many others. And we've still continued to have tradespeople come down and help and work alongside our group at the hospital to help keep the hospital maintained. And it certainly is a beacon of hope for many throughout Haiti. Our model is one of providing strong public health systems. And to do that, we talk about the S's of staff, stuff, space, systems, and social support. And the space aspect is really key, that we have dignified facilities for our patients to be able to receive care that they so richly deserve. This is only possible when we are committed to and work to providing these spaces. And we couldn't do this without the many support of many of you on the phone and the trades unions. This is also critical in all parts of the world and also in the United States, which is why this is such an important endeavor to keep the construction industry open. So what have we learned from COVID-19? I think we learned that it disproportionately impacts those who needed the care the most. And although we're the richest country in the world, our public health system has not been built to combat this pandemic. We know we can't do this by government intervention alone, and we need to be all working together to get through this. It has to be a comprehensive response that includes certainly testing, vaccine rollout, and caring for those who need social support during times of isolation and quarantine. Here in Massachusetts, we were so honored to answer the call from Governor Baker to work closely to stand up a contact tracing effort that is one of the most comprehensive in the entire country. So we'll get through this winter together, and it's only through collaborations such as this that we will. We know that this has been the worst pandemic that we've all faced, and now's the time to not let our guard down. We need to beware of pandemic fatigue, and we need to continue, as Mayor Walsh said, to care for each other at home and certainly on the job site. And there's ways that we can do that. We're very grateful for the leadership of the building trades unions. Your industry will lead the way with this innovative programs to keep all of us safe and to keep everyone on the job. Thank you very much.
Thank you, Sheila. Thank you for your remarks and for your leadership. It was our great honor to work with you in Haiti, and it's our great honor to work with you now here in our own region in this challenging time. We appreciate all you do at Partners in Health, and we appreciate your whole team. Thank you so much, Sheila. Now, it is our great honor, and I'm glad to welcome Dr. Claire Cecile Pierre this morning to our show. Dr. Pierre is the Chief Medical Officer at Harbor Health Services and a longtime international healthcare systems developer. Dr. Pierre worked in Haiti following the multiple natural disasters that devastated the nation earlier in the decade, and is now leading the fight against COVID-19 with her colleagues at Harbor Health. Thank you for joining us. Dr. Pierre, welcome.
Thank you so much for having me, Brian, and thank you for the introduction. It was really wonderful to hear Mayor Walsh's comment and to hear Sheila remind us of the larger partnership and the larger efforts that we've been involved in with the trade unions. I'll take a moment to thank everyone on the call, because I do realize that fighting COVID requires so many of us. It requires members of the private sector, the construction workers, the union partners, the clinical delivery systems, the community health workers, all of us together. And I think what this is about today is about us coming in and saying, how do we make sure no one is excluded? And this is something that should be a part of our conversation at every point of this pandemic. When it first started, now that we're having access to testing, and as we go along, the more technologies become available, we will always come back together and stop and say, how do we make sure that everyone who needs access, everyone who deserves access, is getting it? So I'll start by sharing a few words about Harbor Health and community health centers in general. Many of you may be familiar with community health centers, but not all of us are. I didn't hear much about them until later in my career. So community health centers started actually here in Boston. And they started because a group of community activists got together with doctors and realized that people who needed access to care were not able to get them because of the structures and the discriminations that were in place that made it so that right here in Boston, kids who needed their immunizations had to go to the emergency room. And so they got together and wrote a proposal under the leadership of Drs. Geiger and Dr. Gibson to work on this idea that would be a new type of clinic, one that wouldn't just provide medical care for your physical illness, but that would include your entire health system. So they would provide care for mental health and oral health and women's health and everything else, so all in one place. But they realized that health is not just about access to healthcare systems, but it's also about having a healthy life and a healthy neighborhood, access to jobs, having water, so all of the social determinants of health. So these clinics called community health centers were actually designed to fight poverty with healthcare. That is literally what was written in one of the articles covering this new model. The thought was that these doctors worked together from Tufts University and proposed to the president of the country at the time, and this was in the 1960s, that we would have one first urban clinic, and that was in Boston, and then another in Mississippi, to really have a model that provides the medical care, supports the social determinants of care, and have in it 4 principles that we would always follow. And that is that it will be located in an area that has the highest need. So we go to where people need us. That would provide comprehensive set of services, and that our staff will reflect the communities that we serve and will get an opportunity to grow professionally. So that we're basically creating jobs while providing services. That we would be open to everyone, regardless of ability to pay. And that governing us would be a patient majority board, so that the people on our board actually reflect who we serve. And so today, I'm proud to say that Harbor Health actually includes that very first clinic from the 1960s. From 1965, our clinic was and is still here. It's the Geiger Gibson Health Center. We have grown over the years to include multiple locations. We now have multiple primary care community health center locations from Boston to the Cape. And we also have 2 PACE programs, which are centers that are dedicated to caring for the elderly. Since this happened in the 60s, actually Massachusetts has a great history of adding and creating community health centers. And right here in Boston, many of us exist, community health centers that are independent in each neighborhood, really working to serve and design services to support the communities that we serve. You know many of them, and right in Cambridge, we also partner with Safety Net Hospitals to do the same thing. And so when we step back, what's happened since the 60s is that there are 1,200 community health centers in the United States, serving 30 million people. Most of the patients we serve are underserved. And we are able to do something that many people wouldn't expect. And that is that although most of our patients have difficulty accessing care because they're uninsured or underinsured, although because of language barriers and being from other ethnic groups, because 63% of our patients represent different ethnic groups, and although 91% of our patients are low income, we are still able to show that we can deliver primary care. We can take care of chronic diseases, which is really important. We can look at preventive measures. And we have found when we compare community health centers to national health centers, and you can find this data on the National Association of Community Health Centers website, for diabetes, for hypertension, patients who come to community health centers do better. We also continue to impact the economy because we hire people and we help keep people healthy. And it's estimated that we create $54.6 billion in total economic activity. So when COVID hit, it was hard. It was hard for us in so many ways. The very people that we serve were affected most. And since we reflect the communities we serve, we were affected too. And what we found is that we had to transform ourselves very quickly. We had to make sure that if there's technology available for people to receive care remotely by telehealth, we had to make sure that was available to our patients too. If testing was available, we had to make sure that was available too. And this is why this concept of this partnership is really important to us. We don't see communities for community health centers as just defined by the patients who currently see us. We see communities the way it was initially envisioned when we were created, which is all of the people in the neighborhoods, in the areas that we're trying to serve. And we know for that there are many essential workers. We know that there are plumbers, there are electricians, there are others, and not just them, but their family members who are also worried about COVID. So in these conversations with Partners in Health and the trade union, we realized that there wasn't really access to testing in a way that was best or really responsive to the needs. And so what we're hoping to provide through this collaboration is this. Basically, we're going back to our roots and saying what we were designed was to provide the services at the point of care and to provide it at the point of need. And to do that, we had to go to where people needed it most. And thanks to the open collaboration and conversations, what we're proposing is that we will work together to create hubs, mobile mini clinics that will be right where multiple construction sites are together, so that we remove the barrier of access through transportation, coordination, and all of that. And then right there on site, people will be able to, once they're worried because they have contact with someone who was positive or because they have symptoms, walk over, leave their work site, get tested right away, and then leave and stay safe until they know what their results are. And then we would then be able to provide them with the clinical guidance they need. I think Mayor Walsh mentioned that it's testing, tracing, and treatment. And treatment may mean supportive isolation, calling someone and say, I'm sorry, your test does show you're positive, and I know you need food, or what do you need? Who else is in the house with you? Family members, how do we support them? Are they worried about getting primary care? And we can connect them back to care. So the whole point of this is that this idea and this collaboration, it is a public health intervention to improve our access to testing for COVID for those who need it most, but also to make sure that we don't miss them and we don't miss their family members. Because we know people sometimes live with aunties, with partners, with roommates who may or may not have access to testing themselves. So I'm really excited to continue this conversation throughout this morning, Brian, with everyone else, and to hearing everyone else's comments. And really excited about trying this, testing this, and really saying the element that's important here is the partnerships. It's all of us coming together for those who need it most. Thank you.
Thank you, Dr. Claire. We appreciate all of your help. Just want to make sure we are live here. So I just want to say thank you to Dr. Claire. Thank you for your incredible work to keep our communities healthy and safe during COVID-19. I, along with several of my coworkers and our coworkers in the industry, are proud patients of your incredible work at our community non-profit health centers at Harbor Health. And we look forward to joining you on our upcoming panel, which we're going to invite next. Now, we are very pleased to introduce our next speakers. Joining us for our first panel, our panel of health experts, Dr. Joia Mukherjee and Dr. Margaret Bourdeaux. Dr. Mukherjee is the Chief Medical Officer at Partners in Health and has been a leading voice in the organization since 2000. Her work with local communities across the globe has spanned the outbreaks of several infectious diseases, including HIV/AIDS, multi-drug resistant tuberculosis, and Ebola. Now, Dr. Mukherjee and her colleagues at Partners in Health are spearheading key public health awareness efforts to combat the spread of COVID-19. We are thrilled to have you here this morning with us.
Thank you, Brian.
Also joining our first panel is Dr. Margaret Bourdeaux. Dr. Bourdeaux joins us from Harvard Medical School, where she is the research director of the program in global public policy. Her work focuses on health security, crises around the world. She has worked with the U.S. Department of Defense on critical global health initiatives and is a leading voice in the fight against COVID-19. Let's welcome Dr. Margaret Bourdeaux, Dr. Mukherjee, and welcome back Dr. Claire for our next section on this important panel. Thank you. Thank you all for being here.
Thank you, Brian.
Yeah, so, go ahead, Brian.
Dr. Bourdeaux, we'll start with you. We have a few questions that we'd love to tee up for all of you, and from there, we will start the next. We will hear from all of you. Dr. Bourdeaux, why is it important for this initiative to get off the ground, and why are you joining in this fight to fight COVID-19?
Well, thanks so much, Brian. All the prior speakers, I just can't say enough about what an honor it is to join you all. And I'm going to echo a lot of what has already been said. I am going to start with a little bit of a personal story, which is about the scarf I'm wearing. It's not only cold in my daughter's room, where I'm joining you from, but this scarf is actually made from the silk from my grandfather's parachute in World War II. He was an aviator, a fighter pilot, and he was a lieutenant colonel at Fort Bragg in North Carolina at the base there when it first started. And that's where he met my grandmother, who was 18-year-old at the time, and she was the secretary for the general. And, they both told, a lot of stories about meeting and that time in their lives. And I think what really struck me was the common theme throughout all of the stories was really how hard it was really to not only come together at that time of crisis in the country, but the enormous effort that they made to bring together the organizations, the systems, the administrative processes, the coordination mechanisms to really support the war effort. And, my 18-year-old grandmother was 18-year-olds at the time. She talks about, running out to make sure that the telegram was sent to the winter supply company to tell them where to send the winter boots to troops who were actively fighting in Belgium. And if she didn't send the telegram on time, it didn't get to the right place. Those folks wouldn't have shoes in the middle of the winter. And I think, I got the scarf out right in March when COVID started, because frankly, I was very, very frightened when COVID, the COVID crisis hit. I was frightened because I didn't have any doubt that Americans at an interpersonal level would come together, to support one another in ways that they could. I was really worried, though, because I knew that it would be very difficult to bring the organizations and systems together that would be required to underwrite the security of everybody. And so I am enormously proud of this evolving coalition. And when I saw the role of trying to help bring different groups together around this issue of providing testing. So testing is really a very critical piece in the public health effort. You can't help people if you don't know, who's infected and where the infection is spreading. And so I'm enormously proud to be part of this coalition with the construction industry, with the building trades unions, with the community health centers, with Partners in Health, to try to stand up easy, convenient workplace testing that will also be connected to getting people the support that they need to navigate their lives in the middle of this pandemic. And so, my little hope here for the future is that I will give this scarf to my children and their eventual grandchildren. And when they wear it, they will not only, reference their great grandparents, but they'll also reference us and what we do here together. They'll think about how we work very hard to create the systems that underwrite our collective security and health.
Dr. Bourdeaux, thank you so much for the personal story and for sharing with us the importance of this coalition. And through that story, it was amazing. Thank you. Would like to ask the same question to Dr. Joia. Joia, why is it important that this initiative got off the ground, and why are you so invested in seeing this through to protect it against COVID-19?
Yeah, thank you, Brian. And that was such a lovely story, Margaret, and just a pleasure always to be on the panel with you and Claire. Organizing is one of the fundamental principles of our work at Partners in Health. We know that the right to health takes community organizing and takes government support. And that's what we're seeing here. The amazing words of Mayor Walsh, the amazing coordination of the building trade unions, and then all the partners that are joining on this phone. And if you think about the history of organizing in Massachusetts, it is no wonder that, this conference is happening and this program is being launched. We have a long history of unions really fighting for what is needed, from, early bread and roses strikes in Lawrence to some of the first 8-hour day work. And we have experienced the power of solidarity from unions, as Sheila well pointed out, with our work in Mirbelet. There are many things that we can do personally, but all of us are doing those, and we have to keep doing them and remain vigilant. But when I think, I'm an infectious disease doctor, and when I think of how we control infections like tuberculosis, which is also airborne, like COVID, there are really three spheres. We look at the controls administratively. How do you set up and design a system? The environmental controls, which is like, what is the actual workspace? And then the personal protective equipment. And what we're really talking about here is improving the administrative controls by saying, how do we assure that everyone can get tested? How do we assure that infection control is on the minds of everyone? That's the idea of the administrative control, that you walk into a workspace and somebody is thinking about your safety. And that's what unions have long done. When I was a kid from a union family, all of the people in my grandfather's generation were missing fingers. And I always thought when men got old, their fingers fell off. But what I realized is they fought against those workplace hazards. And this is what we are also working on. because the second piece is the environmental controls. And we want to make sure that every site has adequate ventilation, that people have sick leave, that they can stay home if they're at risk, if they are tested positive or a contact. So those administrative and environmental controls are something that you add within the job site to all the personal work that we're doing. And so we're really happy to be in this partnership, because even though Partners in Health has worked to stand up contact tracing along with the Department of Public Health, and the governor and the secretary have done such a phenomenal job of getting testing out to communities and really jumping on evidence, as Mayor Walsh has, we also know that people need to get back to work. And there's only one way to do that, and that is through these administrative and environmental controls and making work sites safe. And we know there's no more important engine and marker of the economy than construction. And so we are just delighted to be with you. We are delighted to be thinking about organizing with workers, with job sites, with the mayor, and trying to figure out how this long and rich history of organizing in the state of Massachusetts, of strong leadership. I mean, the Secretary of Labor who, fought for decent work hours was Frances Perkins, a graduate of Mount Holyoke. I drive by her street every day, street named after her. So we have a history, and we can show the rest of the world how not to just reopen the economy, but actually to put in the proper controls to give people comfort, safety for themselves and their loved ones, even if they are going back to a job site. So we're thrilled. Thank you so much for including us in your thinking and your work.
Joia, thank you so much for that, for your thoughts here. And I just want to echo what we just heard, and that is that this is going to be both the personal approach to this work and the systemic approach to this work. And it is so important that we organize at both levels to make this a success as we fight against COVID. And I would just like to invite Claire. Thanks so much for rejoining our panel. Any thoughts on why it's so important to be coming together as a coalition and getting this off the ground?
Well, as Joia and Margaret mentioned, Brian, this is a big part of who we are and what our mission is at Harbor Health. It's also a big part of what our personal relationships have been, right? We realize that every one of us is in relationship to others. And whether you know someone or not, it happens that I believe most people in Boston have some impact in their lives that they must and should be grateful for trade unions work for. Like, regardless of the weather, regardless of the season, people out there making sure buildings are safe. I can drive by something and know that it's not going to fall. I can go to work or go to a meeting in a few months, and it's because of things that I don't even understand, but are working well within these buildings. There's talent, there's hard work that we don't recognize or don't see every day, that is happening all the time, and that is happening through COVID. And so it's the least we can do as a gesture of thanks to make sure that we remove or facilitate access to COVID testing as a first step. To me, this is really just the first step, and it really is something that we hope we learn from, and that this coalition continues, so that we look at not just Harbor, but at community health centers in general and clinical systems, and how they partner with unions and trades and workers and the private sector and construction workers and others and construction companies and developers, and say, hey, if we really believe everyone should have access to healthcare, and if we really understand that we're all connected, that the impact of COVID on you affects me, and maybe the impact of health, your hypertension, or everything else affects me. Maybe we will learn from this coalition, not just about COVID, but about how to improve health for our communities in general. So to me, this is really at the source of where we started at Harbor Health. And you know that it's personal for me in a lot of ways. I was born in Haiti, so I'm also thankful for those who were there after the earthquake and continue to be there and do the work. So thank you. I'm really excited about this collaboration.
Thank you, Claire. Thank you very much for these very important messages. And this is a pathway. And I think that if we can, get to our next question on number 2, It's how could you help us think about this through the industry lens? What are the simple basics that we should be sharing across all of our job sites as construction unions, construction companies, development teams? What are the simple things that we should be echoing so folks are staying safe, so workers are staying safe in our industry? And if possible, I will start again with Margaret, if you don't mind jumping on this question. Thank you.
Thanks again. Yeah, I mean, so excellent question. I think that I would re-emphasize what Joia said, which is, we really have to think different. Okay, and we're in a moment we have to think very differently. We have to think differently about what our health means to other people. And that is hard because I think probably many of the folks on this call were raised in an ethos that I was, which is, a little sniffle's not going to stop you. We're going to get there. We're going to get the job done. We're not going to, we're going to kind of muscle through, on our own. And that's just the wrong way to think about this crisis. And it's the wrong way to think about our health in general. And so, it's just a moment where we're going to have to take a step back and realize that nobody can muscle through COVID, the illness. No one community, no one actor, no one organization. It is going to take all of us thinking different about how we impact others. I think the thing I would echo that Joia laid out so beautifully is that there really are sort of three. I sort of categorize them in three sort of different strategies. One is the personal behaviors, and I think that's what a lot of folks are, have been hopefully hearing about, personal behaviors like wearing a mask, trying to stay, distant from others if possible. And certainly washing hands, after touching surfaces, all, of those, the masks are super important. But those are the personal behaviors that do stop transmission and do keep people individually safe. That's a critical thing. Everybody can do. I think that the other two pieces are really important too, to understand that we have to think about the workspace and work environment and the ventilation and the air filtration and how workflow is set up. And so that's another piece we all are going to have to work on together, but it's not a personal behavior. And the third part, really the administrative organizations, forums, systems, I would throw kind of contact tracing in with that. Those are the three tools that we have, or the three approaches that we have that will add up to, I think, stopping this epidemic, actually even more so than the vaccine. I mean, most epidemics are stopped through public health measures. Like these. And so I think that's an important message. I'm very excited about, the therapeutics and the vaccines that are coming on board, but we can't wait. We have to think different. We have to think about how our own health impacts everybody else. We have to work together to stand up the systems that protect ourselves. And we can't do it alone.
Margaret, thank you so much. That is an incredible point, and it's actually an interesting tee up for our third question, which is if we're going to ask you about next steps. But before we get to next steps, it is important, and we are trying to push the message collectively, and it's been amazing on all of these phone calls. How do we focus on keeping people safe at work and at home? And Dr. Joia, if you don't mind following up on Margaret's comments around some of the basics on safety, how do we start to capture these basics to keep people safe at work and at home, please?
Yeah. So, I think those were great comments by Margaret. I don't have a lot to add, but will reiterate the idea that if you have any symptoms, or if you have a close contact, meaning a person that you have been, within 6 feet of for more than 15 minutes who comes down with the virus, you should get tested and you should quarantine. And I think that's the problem with this. When I think of all the different infectious diseases I've been involved in controlling for the last 2 decades, we usually have some symptoms, not always. And I think that was the reason HIV got out of the barn in the way it did, because there's a long period of asymptomatic spread. But in COVID, we know that there is 5 to even 14 days of asymptomatic time where people can be spreading the virus. So first of all, if you have symptoms, get tested right away. There's testing available and we're working. We don't know exactly how this is going to unfold with Harbor, but we're working hard on it. So get tested if you have symptoms. If you don't have symptoms, but if you know somebody who in your household that you've been in close contact with who is diagnosed, you need to let your manager know and say, I think I'm going to have to quarantine. And we need to figure that out because that is how this infection is spreading. And then the other thing is we have to look on the job site at anything that would bring people together too closely, whether it's a lunch break, whether it's working on an indoor, facility and there's more than 2 people in there. Like we have to really think because those are the events, and we've been looking with the Department of Public Health at these kind of what sometimes people call super spreader events, but it's more that if you have people packed together and just one person has COVID, it will infect everyone else. So, obviously the hand washing, wearing masks 6 feet, everybody has known that, and we still have a hard time doing that. But I think with specific reference to the job site work, it's about really knowing your own symptoms and staying home. And then also if you're a contact of somebody in your household, that you really need to quarantine. And I think working with the building trades, we've got to figure out to make sure that people can do that and not suffer economic hardship. Because the problem is if people don't work and then they don't get paid, they're going to have, it's not that they're doing anything wrong, they're trying to feed their family. So I think that's really the challenge. How do we make that feasible for people to stay home if they have symptoms or stay home if they're a contact? And we'll be, working with you on that.
These are amazing answers. And these are some of the challenges that we're facing. So this type of feedback and expertise is exactly why we're so excited to partner with all of you. Because you're right, our industry is an industry that says, let's get to work and let's get the job done. But in this time, that's not an option. If you are feeling symptoms or around someone that has symptoms, it's important to stay home and get tested. And that is great advice. And thank you for sharing that. We want to keep pounding that message. So I'd also like to bring in Dr. Clear, if you'd also like to weigh in on the second question of sticking with the basics and how important it is to stay safe.
I would completely agree with what both Margaret and Joia have mentioned. I think the only thing that I would add is this. Something for some people about getting sick that can feel shameful. And there's something about getting COVID that can feel embarrassing because it's like, I'm not going to get it. I know what to do. I've been doing it and so on and so forth. And what we're finding is that that there is no shame in being exposed. If you could see it, you clearly wouldn't catch it. So you didn't get it on purpose. And so one of the things we would remind people is that there is no reason to try to pretend like you don't have it. And it is our job to make sure you have access to testing and have access to treatment. So the 2 parts that I would add here are come get tested if you have symptoms, as it was mentioned. Come get tested if anyone is positive near you. That's true. But also, please don't forget, if you feel uncomfortable, let us know. And this is where I worry that those who are most affected aren't connected to care. And this was where I think this is not just testing and tracing, which is so important. It's also treatment. And for some people, treatment may mean that there's a nurse who calls you every day and sees how you're feeling, because we know that somewhere between the 4th and the 7th or so, some people get so sick that they need to go to the hospital. And if you miss that because they're dehydrated and tired, they're sleeping more, they can get to the point where they're so sick that we can't do anything. So what we want to make sure is that people understand what the disease looks like. For some people, there's no symptoms, and for people, they get sick really quickly and really fast. You know that there are some communities, especially those who, as we know, get paid less, of color, have work that actually requires them to do heavy manual things. For some reason, like the exhaustion at work and then coming back and trying to push through symptoms is not the best, because this disease can rapidly become fatal, and we forget that. So please, in addition to getting tested, in addition to encouraging people to answer the calls, that if they see it, they can get traced so we know who else was in contact with them, please connect to treatment. If you don't have a primary care provider, find a community health center, find a clinic. We're around, and we will monitor you to make sure that you're safe while you're positive. And we will make sure that we talk to your family members and talk about the food and the support and all of the other things you may need so that you can safely all stay home.
Thank you, Claire. And I think this is a vitally important conversation for a couple of reasons. We are being joined today by just about every stakeholder in our own industry, and that's why we're trying to create a roadmap to create a safer construction industry. But we're also being joined today by allies from other industries, and we want to get this right so that other industries can take on these best practices that we hear from our experts today and make sure they're implementing in their own industry as we get people back to work safely for all of the reasons we've heard today, which are to put food on the table, to support your family, to create stronger communities, and to do it through the lens of equity, to make sure everyone has access to what it takes to build strong families and communities. And quickly, because I do want to make sure that we are conscious of everyone's time, and you've been an amazing panel, but we've had great conversations over the past few weeks about the importance of the step now and the importance of the steps coming up. There's a lot of conversation happening around where folks are hearing about vaccines and new therapies. Can you tell us, as an industry, how should we be approaching the immediate term and maybe the longer term? But please, is something I just love to hear that health experts say how you feel about vaccines now compared to vaccines later, and how it affects everybody who may be waiting for one. And Dr. Bourdeaux, if you don't mind, we'll start with you. Thank you, Margaret.
Sure. Yeah, so I'm glad you asked. Overall, it's very exciting, the vaccine development and how rapidly it's unfolding. I guess the stance, though, the way that I think this group should think about it is that we should not try to, again, muscle through this until we get the vaccine. I think that we have the tools to actually control and mitigate a lot of harms from this pandemic, drive down rates significantly with non-vaccine public health measures alone. And I sort of want us to dig in and set up this and build this coalition and set up the workplace protections and the testing and the tracing and the treatment access, as if there isn't a vaccine, so that we get on top of this. I don't want to go through such a dark winter with so much death and infection and economic consequences, frankly. So I want us to proceed like there's not a vaccine. I want us to get the job done without that. Now, that being said, I also think that this coalition will stand us in good stead as the situation changes, and as there are more therapies and the vaccine do become available. I think that there are. I hope and I think that this collaboration will put us in a good position to figure out issues around distribution and equity. So. I think that answers your questions. A little bit opposite answers to the question, but that's my hope.
Dr. Margaret, we think that's a great answer. So right now we must stay vigilant as we hear these wonderful things happening from our healthcare experts and the incredible work they're doing. But now is to hunker down and stick to the basics to keep people safe. Does that sound right? That's right. And we can. It's not just about hiding from the virus. We can actually put in place systems by which people can live their lives, go back to work, while we control the virus. So, but that effort takes a lot of work and takes the work that this coalition is launching on. So, absolutely, not only stay vigilant, but go on the offense against the virus together. And when the vaccine comes, that'll be a great day. Wonderful. Thank you, Dr. Margaret. And I think what we'll do now is enter into any closing thoughts that everyone has from this incredible conversation. But I'd just like to say first a huge thank you. This call around turning this into an organizing opportunity to get this message, to work together, to get it out there. I think the labor movement, as we've heard from all of you on the phone, is about creating equity and justice in our communities. And that is something that the building trade unions feels very strongly about. In the past 10 years, we have focused on creating access to gender equity, racial equality, and making sure that anyone, here's the goal, it's a dual mandate, to make sure that every job in this country is a good job and to make sure that everyone has access to them. And these types of things that help families and communities and to keep people safe during COVID-19 is exactly the message that we want to share. And so we are hugely appreciative of you helping us do that today. But having said that, would love to offer to you any final thoughts because this has been an amazing panel and we cannot thank you enough. So in the same order we've done for the entire panel, I'll start with Dr. Bourdeaux first. Please, Margaret.
Well, just to say thank you, Brian, your work has been tremendous and you have really worked to overcome every hurdle and barrier. And it's just been wonderful to get to know you personally and also to understand more about what the leadership of the Building Trades Union in this space. So just a huge thank you from me to all of you.
Feeling is mutual. We appreciate it. Thank you, Dr. Bourdeaux. Dr. Joia, please, any final thoughts?
Also, just thanks to you all for organizing this work, for all your organizing, because decent jobs are a fundamental part of good health. And we call these things the social determinants of health, but they're really social forces. And employment is a critical way that people stay healthy because they can put food on the table. And so we want to help you do that piece of health. And then we can focus on the caregiving, the prevention. So it's really an honor to work with all of you in Boston and beyond.
Thank you, Dr. Mukherjee. We really appreciate it, Joia. Thank you.
Yeah.
And Dr. Pierre, please, clear. Any final thoughts?
Sure. I think this is incredible. I think we all know that the health equity mission of this is important. We also know that having public representatives supporting this message and understanding the importance is great. We understand that employers, construction workers, all of the relationships are difficult and complex. We understand that we're bringing together partners that have not worked with each other before. But I think what I hope we hold on to is this. We are learning together. COVID has been here for a while, but it's still new to us. As new technologies show up, as new information comes up, we hold it to ourselves to learn and to share. We're going to test this process and figure out the best approach. And lastly, what matters most is that we're doing it with you, not for you. And so we truly appreciate your engagement in this, and we appreciate and expect your feedback on this, because all together we're going to learn how to make this better. So thank you again for having us, and I'm excited at Harvard to be a part of this collaboration.
Thank you. And on behalf of all of the building trade unions and all of our contractor and development partners, an enormous thank you for your incredible efforts through this very difficult time. And I would just like to close this panel by saying thank you to Dr. Bourdeaux, Dr. Mukherjee, and Dr. Pierre for speaking with us this morning and sharing this critical information and for being part of this important Construction Stops COVID event. You're amazing partners, and we're so proud and appreciative to be working with you, and we look forward to next steps. Thank you all. Thank you, everyone. And we would like to take a timeout right here, just an information note before the next panel. And that is, it's the importance of all of us coming together as an industry. There has been amazing work from every level and every stakeholder of this industry to combat COVID-19. And we took the important step of creating a fund, the Construction Stops COVID Fund. It is an industry-led, industry participatory 501c3. The Construction Stops COVID Fund is reliant on the contributions of our many generous industry supporters. We would like to thank our union and contractor partners for your generosity to this point, and a special thank you to John Moriarty and Associates, Suffolk, Turner Construction, Harvard University, HYM Investments, WS Development, and so many more. It is important. We will be putting up a link to this after the event and sharing it widely. Please do all you can so we can build this infrastructure to keep not only the industry safe, but all of the communities around them, so that we have been doing the important work of keeping people safe at work and at home to beat COVID-19. Thank you. And the link that you can see on your screen now, we will be sharing after this event. So with that, thank you for that. And now we're moving back on to our next speaker. It is a huge honor to invite Mayor Sumbul Siddiqui to join us today. We would like to welcome our ally and a fair supporter of working families and a champion for public health, Cambridge Mayor Sumbul Siddiqui. Since the start of the pandemic, Mayor Siddiqui has launched the Mayor's Disaster Relief Fund, increased internet access to low-income families in the city of Cambridge, and expanded free COVID testing to all Cambridge residents, among many other great accomplishments. We'll invite the mayor to share some remarks now, and after which she's agreed very generously, and we have the great honor of her helping us to moderate our next industry panel, and that is going to be an industry panel of construction leaders. So thank you, Mayor Siddiqui, for joining us this morning.
Thank you so much. Good morning, everyone. And thank you so much, Brian. That panel was great. So I'm Mayor Sumbul Siddiqui, and I want to thank the Boston Metro Building Trades for having me here today and for all the work already underway for forging ahead on a national model for COVID-19 safety and prevention. So Cambridge is really similar to many surrounding cities in that we always have a construction project going on. When you walk or drive through Kendall Square, you'll notice several construction projects underway. And as you continue along, you'll see the Leachmere Station and the surrounding area that's continuing to be under construction. And my hope is that many more affordable housing units will continue to be built, which means a lot more construction activity. And with all the construction activity in the greater Boston area, this collaboration between the greater Boston building trades and their unions and their construction industry partners in health, Harbor Health Services, and the city of Boston will have an incredible impact on keeping our workers and their families safe, while also promoting and inspiring many industries and residents to take safety seriously. The city of Cambridge took action early on in March as well to temporarily restrict construction, and then formed a 23-member construction advisory group to provide advice on drafting best practices that the city used to incorporate into a safe construction reopening plan. And now we must continue to work together as COVID-19 cases increase in the greater Boston area. It will take a regional strategy to stop the spread and lower daily positive cases. To combat the increasing COVID rates here, Cambridge has deployed several strategies, some of which include offering free COVID-19 testing to our residents 7 days a week in various locations throughout the city, especially targeting our hotspot areas. We've partnered with community organizations and our public health department to create shelter options for our unhoused residents, which includes testing and safe locations to shelter in place. And in addition to strategies to combat rising cases in Cambridge, we've also addressed the real-life impact and toll the pandemic has taken on our residents' health, their safety, and their livelihoods by launching the Mayor's COVID-19 Disaster Relief Fund. And since April, we've raised nearly $5 million from the community to assist our many vulnerable residents, the businesses suffering, arts organizations that we enjoy in our daily lives. And we're thankful that among those donors are our many construction industry partners and companies who've lifted our communities up during this difficult time. Companies such as Turner Construction, John Rory and Associates, and Suffolk Construction Company have been instrumental in keeping our businesses afloat and our vulnerable residents and families housed. So thank you. This commitment to our community is evident already by this example, by this new and first of its kind initiative really solidifies its commitment. And so I'm so excited to see this multi-platform messaging campaign and regional effort take off, and to see the impact it makes regionally and within our local municipalities. And I'm so proud that our region continues to lead with innovative strategies and approaches to address COVID-19. And I feel confident that this initiative will spark similar strategies around the country and in a variety of industries. So thank you so much to all the amazing collaborators on this project. And thank you so much, Brian, for having me.
Thank you, Mayor Siddiqui. Your public service, your leadership, and your partnership have been an amazing support structure for our collective efforts in the fight against COVID-19. Thank you for joining us today, and thank you for offering to moderate this next panel of construction industry leaders. It is important that we are working together, and to do that, I'm going to introduce now our panelist from the construction industry who will be joining Mayor Siddiqui to have this important conversation. We're excited to welcome and to hear from several key construction industry leaders. Chris Brown, the Chief Executive Officer of John Moriarty and Associates, Jeff Gavea, the Executive Officer of Suffolk, and Maureen Kirkpatrick, VP Operations Manager for Turner Construction. John Moriarty and Associates, Suffolk, and Turner are three of the biggest providers of union construction jobs in the state and have been tremendous contributors to the process of forming this initiative and generally in combating the spread of COVID-19 since the onset of this pandemic. They have played a monumental role in ensuring the construction industry in Boston and Cambridge becomes a safe model for everyone across the country as we are keeping workers safe, healthy, and informed about COVID-19. As previously mentioned, the industry expert panel will be moderated by our ally and our friend, our great mayor of Cambridge, Mayor Sumbul Siddiqui. Mayor, all yours.
Thank you, Brian. Hi, everyone. Thank you so much for being with us and joining us. So Chris, Maureen, and Jeff, we want to welcome you and ask you a few questions. I'll start with a question to each of you. And the first one will really be, how do you feel, why do you feel the Construction Stop COVID initiative is important? So Chris, we'll start with you and then I'll go to Maureen.
Thank you, Mayor Siddiqui, and thank you, Brian, for asking us to be part of this panel today. It's clearly an initiative we need to move forward given the current surge that we're seeing. Over 9 months ago, when the pandemic first hit and our industry was asked to shut down, we took that time to partner with industry groups, our union and subcontractor partners, and the general contracting community to put a plan together that could be consistent, scalable, and sustainable to keep our sites, the men and women who work for us and their families, and the communities we work in safe. And that plan worked well through the summer and into the early fall. However, it became apparent in the last 4 to 5 weeks that further efforts needed to be done to support this initiative. We once again brought our industry group together, but this time we realized we needed additional support and resources and expertise to combat this current surge. We are now extremely fortunate to have joined with Partners in Health and Harbor Health to add their expertise and skill set to help us keep our industry safe. I think that the partnership and collaboration that's been developed here is clearly evidenced by all the stakeholders that are here today.
Thank you, absolutely. How about you, Maureen?
Appreciate what Chris says, and thank you for this opportunity. But for me, it's also just the consistency as a GC and CM, trade partners, the union, the industry, the labor management, that we're consistent on all of our jobs. And I think by us working together, I've seen a lot of vulnerability. I've seen transparent discussions. A lot of us are competing for a lot of the same work, but we have really worked together to really share those best practices and try to get them out to our project sites. And I think it's just imperative that we stay consistent and learn as we go here and keep implementing those best practices. And I think Mayor Walsh said it's the faster we can test, the faster we can trace, and the faster we can treat, the better off our community is going to be. And by creating these sites, making it very accessible to others, I think we're going to be able to get the testing sooner, which will then allow us to trace and quarantine as necessary and treat those that need it. But thank you.
Great. And what about you, John?
So I think that I think it's everybody taking it as the highest priority since the onset of COVID has been very impressive, and especially as you think about this group and how important the health and safety of all of our folks in the building trades and also all of their extended families has been taken as the highest priority. And when you see an industry come together to try to combat a problem or an issue with the amount of horsepower that has been put behind this, it's just a wonderful thing to be a part of. And so I echo the statements that Maureen and Chris had made, but the way that the industry has come together has been unlike anything I've seen.
And thank you, Jeff, for that. So on the topic of testing, and I thank you all for your leadership throughout this pandemic, how do you think this testing initiative improves upon the public awareness and preventative health and safety work you did in the spring and summer of 2020? So I'll start with Maureen.
think on the testing, it gives people a sense of comfortable, like they're comfortable. They know that we're looking out for them. We're looking out for them, for their safety, but also for their friends and families who they interact with. We just initially started testing actually this week at Turner and received a lot of positive feedback from everyone that we actually care about the employees and we care about their friends and families. And there's so much interaction on the job site, from the personal coming in and then actually day to day on the job, hour to hour, that us being able to identify those people early and give everybody the opportunity to test so that we can take the next steps and we can keep our job site safe. We're seeing a lot of personal life instances come into our project sites, and that's what we need to be able to identify early so that we can treat and stop the spread on our job sites and industry.
Absolutely, that's so important. And how about you, Jeff?
I think it comes down to visibility and access, right? So us as an industry saying that we are going to try to combat this by setting up testing facilities that are quick and easy for our folks to get in and out of is very important as it relates to people, putting people's mind at rest when they're thinking about, how do I go about getting tested, right? So these facilities are going to be close by. They're going to be easy for people to drive in and drive out of, and I think it really is about it's about access and visibility, and us as an industry showing that we're doing everything we can to try to give people the easiest way to get tested.
Absolutely, access is key. And how about you, Chris?
I think we heard it earlier on from our healthcare panel that this disease or this pandemic has a high level of asymptomatic cases, and so testing becomes even more critical given that factor. And the collaboration we're about to put in place with Partners in Health and Harbor Health brings us access to a number of things that will help us provide a safer work environment for all of us. First and foremost will be the immediate access, industry-specific access to testing facilities. It gets us timely results and feedback, which will help with the contact tracing, which is so critical to combating this pandemic and effectively reducing the risk of job site cluster and spread. And it also gives us a constant pulse on the most effective strategies and best practices that in the appropriate support in implementing these from some of the most qualified healthcare professionals in the world. And so I think this initiative will really go a long way to helping keep our industry and the communities we work in safe.
Definitely. And this has been talked about, but I think it is important that all of you are here as an industry. But I'd love for you to speak a little bit more about that and talk about why it's really important to your companies to be here together. So we'll start with Jeff.
But first and foremost, I think it's about we have a lot of individuals that work very, very hard in the building trades. It's an essential operation, and in not all cases are you able to be as distant away as you would like to be, right? And so when we talk about respect and acknowledgement to our folks and showing that the industry is putting our foot forward to make sure that we're doing everything we can to keep people safe, and we respect what they do every day. We're acknowledging that it's not an easy situation to be in for either them or their families, and it shows a great appreciation, I think, that this coalition gets together in order to try to give people as much peace of mind in a very difficult situation. That for me is why I'm happy to be involved, and I'm thrilled to be part of this, because it's about first at the top of the mountain, it's respect and acknowledgement.
Thank you, Jeff. How about you, Chris?
Our goal as a company, and I think Maureen and Jeff both echoed this earlier, as an industry in general, I mean, we are all in partnership, in firm unison on this belief that the safety, health, and well-being of the men and women who work for us every day is paramount. They are our most valuable resource. In addition, we have an obligation to keep the members of the public we interact with in the communities we're privileged to work in safe as well. And this initiative with the Construction Stops COVID Coalition gives us the best opportunity to accomplish that.
Absolutely. How about you, Maureen?
Yeah, I would echo what both Jeff and Chris said. I think it's extremely important that we, with this coalition as an industry, are showing the individual tradespeople that we care about them, that we are actively caring for them and caring for their family and friends by providing this outlet, this testing. And, I hope in the future that with this fundraising and with the money that we're going to create for this fund is we're going to be able to add even more testing and maybe more sites or mobile sites, that we can have a greater reach.
Great. Thank you so much. It's about safety. It's about people at the forefront. And I thank all of you for, again, for your leadership and for your partnership and for being here with us today. So thank you.
Thank you.
Thank you.
And I will give it back to Brian.
Thank you, Mayor Siddiqui. Great job. We appreciate all of your support and all of the efforts you've put in place to keep people safe. And you've been a tremendous partner in helping us get this off the ground. So thank you. I'd also like to say thank you to Chris, Maureen, and Jeff for sharing your thoughts on keeping our job sites safe and keeping our surrounding communities around them safe too. So thank you to Mayor Siddiqui, Chris Brown, Maureen Kirkpatrick, and Jeff Gavea for a really insightful and important panel. Thank you. So before we get to the last bit of housekeeping, we would like to say a very special thank you to Mayor Walsh, to Mayor Siddiqui, to Sheila Davis, to Dr. Pierre, to Dr. Mukherjee, to Dr. Bourdeaux, to Chris Brown, to Maureen Kirkpatrick, to Jeff Gavea, and to all of our local unions. The Greater Boston Building Trade Unions have done a phenomenal job, and to want to say thank you to everyone's efforts who've made this possible. To our contractor partners, development partners, our labor allies, and elected allies, we thank you. Not just for joining us on this important discussion for today, but for everything you're doing to keep our communities safe. Together, we can ensure safety for our coworkers, our community, and our loved ones. And that is the goal of Construction Stops COVID. So with that, the last bit of housekeeping again is we would like to thank everyone for all their hard work over the past several months. We'd like to put the graphic back up that this is just the beginning of the next phase of stopping COVID. So please take a look at this graphic. We want to make sure that you understand the importance and are able to find a way to support this initiative in Construction Stops COVID. We look forward to next steps in keeping our industry safe. I want to say a huge thank you. And again, that slide is the newly formed or newly forming 501c3 organization, Construction Stops COVID. It is reliant on contributions of our many generous partners. So please grab that link. We'll be sending it out after this event. And we want to make sure that everyone has a hand and everyone has had a really proper effort here, but a hand in continuing this great effort. We want to thank our panelists again, thank our sponsors, JMA, Suffolk, and Turner. Thank all of the people who made this today possible. So with that, please, we want to make sure that you're able, for audience members or members of the media with follow-up questions, you can email info@constructionstopscovid.org. and someone will get back to you promptly. And you can also visit our website. This is for all of us on this call and anyone who you want to share this with. Please share constructionstopscovid.org, which many of you visited to tune in today, but please share the message through that means. This concludes our program today. Thank you again for your support in this historic effort to stop COVID-19 in our industry and beyond. And we look forward in the next steps to stop COVID. Thank you to Construction Stops COVID and everyone who's been a major part in helping us do this important work to help both our industry and our communities. Thanks, everyone.